this was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time.
Welcome to Wellness and Dentistry, where today we're going to be talking all about, Doctor, you're not lazy, you're exhausted. I'm joined by my co-host and my dear friend, Dr. Kyle Stanley, who is a dentist, tech entrepreneur, speaker, and researcher. And my name is Dr. Martin Mendelson. I'm a disabled dentist, coach, speaker, and author. My first book is coming out in less than 2 months called One Move Makes All the Difference, and it is available for pre-order wherever books are sold. And together, we've helped thousands of dental professionals pursue wellness and dentistry. And if you're unfamiliar with us, check out our respective links, websites, and course offerings on the wellnessanddentistry.com website. And if you like what you are hearing, please leave us a review, share our podcast with your colleagues. It would mean the world to us to get this content out to a wider audience. So, Kyle, hello, welcome to you.
Hello.
So it's a tongue-in-cheek title, but very serious subject, right?
Yeah, well, when I was in my deepest part of burnout, so this was in 2018,
Mm-hmm.
I remember starting to feel like I was lazy,
Yeah.
which was something to me that is the exact opposite of my personality. I am like
Mm-hmm.
work hard, work hard, work hard, and play hard later kind of
Yeah.
guy, like very much a delayed gratification person.
Yeah.
And I got to the point of where I started to feel lazy, and I think that's because I was depressed.
Mm-hmm.
And so I started to feel exhausted all the time. And, that really plays into what we're going to talk about today, which is this
Mm-hmm.
idea of like, you may be feeling like you're lazy, but it could be that you're exhausted. And so what we want to get across today is that you have to take care of your physical self, just like you have to take care of your clinical self, your business self, your mental self that we talk about a lot. But physically taking care of yourself is part of being a high-performing dental professional.
Oh, 100%. And for those that poo-poo the idea of self-care, well, that's just a label. It's basically an idea that you need to put your own oxygen mask on first in order to be your best for your patients, your team, your friends, and family. And it's something that I think we don't do easily, particularly in Western society, especially to take the time for ourselves. I also think that, and I know we'll get into this because this is part of our planning for today's episode. We're going to talk about just workflow and the totality of things that are on your plate because we actually have habits that create that overwhelm and exhaustion more readily than others. And there's things we can do about it just from a mental perspective, let alone a mental health perspective.
Yeah, so here's the thing. The thing is
Mhm.
that dentistry is always going to be challenging.
Yep.
It is not an easy job.
Hmm.
We're doing a multitude of things. We're measuring in microns. We're working on a moving target. It's uncomfortable. It's expensive. It's time consuming for everybody. So that is not going to change, I think, in
Yep.
the near future.
Hmm.
So what we have to do is show up as our best self.
Yes.
You can't get through an entire day of treating patients and managing staff and ordering and having complications if you haven't slept,
Yep.
you haven't eaten well, you're not hydrated, you're physically in a bad situation.
Yeah.
It's kind of like this idea of if you know that you're going to go into a fight,
Hmm.
how are you going to show up? Right?
Yeah.
Hopefully, you're going to be like ready to go, trained, slept well, ate well, you've been on a regiment. And that's kind of how dentistry is. Like you're kind of getting beat up many times.
So we're talking like a boxing ring fight, right?
Yes.
Not like something over, coffee at Starbucks kind of thing. Yes.
Yeah. I mean, it could be. It could be that, if someone challenges you to a fight, I think that you want to show up the best you can. So it's
Yeah.
like, for those of you that are listening, I'm holding my hand up high. And let's say if you start high,
Mm-hmm.
and you know that you're going to get broken down slowly, and I'm going down further and further and further,
Yep.
that towards the end of the day, you may still have something left in the tank. But
Yeah.
if you start in the middle of this fictitious graph that I'm making and you get broken down through the day, you're not going to have anything left.
Yeah.
And that is when we make bad decisions. We're
Mm-hmm.
bad with our relationships. We're poor leaders. We make, I mean, even physical decisions like we get in car accidents, we
Mm-hmm.
make surgical mistakes. And
We
so
we
it's
eat
like
more
we have to
poorly too.
show up. I'm trying to think of something to relate to. It's almost like you need to show up as the sharpest pencil because you know you're going to use that pencil all day. And if
Yeah.
you don't, then you're going to get down to the wood, right?
Yes. But I think we also need to point out the idea that your best on a Tuesday may be 80%, your best on a Wednesday maybe 98%, and your best on a Friday might be 110. Like your best is whatever you got that day, having at least attempted or had a thought process or an intention around doing what you need to do to show up at your best, whatever that best is in that moment.
I
Right.
think intention is a good word.
Yeah.
And Martin and I, we are positive thinkers, but we're realists as
Yep.
well. So people that know me, I have a 3-year-old daughter. My 1-year-old, or sorry, my son, who's now 8, when he was 1, he slept through the night and basically slept through the night the rest of his
Mm-hmm.
life.
Mm-hmm.
My daughter is just over 3 and now still wakes up 3 times a night, probably.
Right.
There's not much that we can do about that.
Mm-hmm.
Now, what can I do? I always like to focus on what I can do.
Yeah.
What I can do is try to go to bed earlier so that even if I have to wake up in the middle of the night, I may still be getting an okay amount of sleep.
Yep.
Try to make sure that I do my exercise at a certain day, that I'm eating right, that I'm meditating so that I make sure that my head is in the right place.
Mm-hmm.
I can't control when she wakes up, but I
Mm-hmm.
can control some of the other habits that I do. So I like what you said, and I think it is the first aspect is having the awareness, and the
Mm-hmm.
second aspect is that intention that you talked about.
Totally. 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 Because there's a level of expectation or judgment that we give over ourselves if we're attempting to always be at our 100%, whatever that is for you, because that's not realistic. And then to beat ourselves up that we're not showing up that way, well, that's not productive either, right? And
Right.
so there are ways that we can look at this both clinically as well as managerially to help to facilitate bringing our best. So, clinically, for example, for those that do have complete control over their schedule, if you're, for example, a morning person, then what are you doing scheduling large cases in the afternoon? And if you're going to look at me and go, well, that's when they want to come in, my response is going to be, have you been to a physician in the last 10 years? Because when you schedule a surgical procedure with a physician, they tell you when to show up.
Hmm.
And so you could argue that yes, that's what people expect. However, think about the opportunity that poses itself to say, Dr. Smith is very much a morning person. He or she likes to complete these cases for you in the morning, and I'm sure you would want Dr. Smith to be at his or her best. Like, what a wonderful message that is.
And who's going to say no to that?
Exactly. Exactly. So we do it to ourselves, right?
And I think on the other side of that too, you have to be ready for patients that say, I can't come in the mornings.
Totally.
Say, okay, fine. Then,
Great.
maybe it's not the right fit for you.
Yeah, totally.
And that is it sounds bad, and I know people are listening to this going to be like, "Oh my God, a patient's going to go somewhere else."
Yeah,
You have to be ready to understand that not every patient is right for your practice.
right.
And if
Totally.
you're going to set a boundary like that, or if you're going to set an expectation like that, having the freedom, it's actually freeing once you make that decision that, okay, I want my practice to be like this. If they can't make it, then fine. And it
Absolutely.
it makes me think of the orthodontist that I go to and my son goes to, and my
Hmm.
daughter may go to soon.
Hmm.
Her name's Audrey Yoon. She's one of the really the leaders
Oh yeah,
of
I've
the
met her.
world right
Yeah.
now, with like early childhood ortho intervention.
Hmm.
She's the lead. She's the orthodontist on the Stanford sleep team, so she's very much involved with airway and sleep and publishing all the research. I mean, she's a total badass. She has three practices. Okay, so she has
Hmm.
one in LA, she has one in like South LA, almost from Orange County, and then she has one up at Stanford, I think, or in San Francisco. And so at the practice that we go to, she's there 2 days a week.
Hmm.
Okay, so it's like Tuesdays and Wednesdays.
Hmm.
It's full when we're there. Now, let's say you can only take your kid to ortho on Fridays. Well,
Hmm.
guess what?
Hmm.
You can't go to that office. And she
Yeah.
is busy at that
Yeah.
office. I mean, when we go there, it's packed.
Yeah.
And it's 2 days a week.
100%. 100%. Yeah, that's just a great example. I mean, look, even in the areas where, jokingly we say there's a dentist on every corner, there's a reason for that because there's a lot of people in that community. And
Yeah.
so there will always be enough people to go around. Um, and I say that, people say easy for you to say, but honestly, you and I together have worked or talked or coached with more dentists probably than most dentists, hands down.
Yeah.
And those that end up really struggling from a business perspective, it's not technically because they don't have the patients coming in the door. That may be a lagging indicator of
Mm,
systems and the way they answer the phone and a whole bunch of
right.
other factors. It's never truly at its core, there aren't enough people. That's
Hmm.
not a thing. That's not a thing.
It's so true. And that happens in the most rural
Yeah.
areas,
Yeah.
in the most dense areas,
Mhm.
like there's positives and negatives about being in rural areas, right? I mean, we had someone that was in our
I was just
Light
thinking
Side
that.
Live course a few weeks ago, and he had like a 1 to 5,000 ratio
Yep.
of doctors to patient, which is insane. Like if you have
Hmm.
1 to 2,000, that's like really, really good, right? He has one
Yep.
to 5,000. But then you may find other remote areas or, yeah, I mean, more remote areas that it's like 1 to 600,
Yeah.
right?
Yeah.
Or the opposite, like my practice. My practice, we have 52 dentists in my building, not in my
That's insane.
town, not in my, uh, you know, area of my city. In my building, we have 52 dentists,
Hmm.
and all of them are doing fine. Why?
Absolutely.
Because there's 14 million people in greater Los Angeles.
Yeah.
So you're right. It's usually not the problem of the patient numbers.
Nope.
And so
Nope.
having that understanding, this is like a good thing. Now that hopefully you believe us that that's
Hmm.
true, now make that mindset shift that you don't need every patient in your practice.
Hmm. Yeah.
And you will
Absolutely.
be so much more free that way. Because guess what? Even the best practices in the world have patients that leave because they don't like the name of your front office team, or because, your walls are blue and they like white walls or something. Like, I
Yeah.
mean, the dumbest stuff. And if
Absolutely.
you take that into, like, take that to heart and like, oh my gosh, they don't like me every time, it's gonna drive you crazy and ask me how I know.
Well, and you could look at this a different way too, because I do this with my clients quite a bit. It's like, listen, answer the following question, not literally. Do you like everybody? No. So why should everybody like you?
Yeah.
Oh, I never thought of it that way. So then, therefore, whether it's, personal relationships or professional relationships, who cares? Because
Mhm.
if you're not looking at it from that lens, technically, you're creating a double standard. Because what you're
Mm.
saying is it's okay for you not to like everybody, but it's not okay for everybody not to like you. That doesn't even make any sense, right?
So
But
what,
it's what we do.
yeah, no, it's exactly what we do.
Yeah.
So, what are some areas from your standpoint where we can think about this topic in more of a organizational way?
Yeah. Yeah. I think that the phrase one is greater than zero comes to my mind. And
Are you
that's the
telling me
first.
one move makes all the difference? Is that what you're
Say,
telling
wait,
me?
What?
Available,
Yes,
available.
it's available December 2nd, wherever books are sold. Yeah. Actually, on the day that Kyle and I were recording this, I received a testimonial from Sean Akor, who's a New York Times bestselling author. His TED Talk has received, I don't even know how many millions of views at this point. He gave me a glowing testimonial, and I'm still glowing because I can't believe this is happening.
So awesome.
Yeah. But anyway, so one is greater than zero. That's number one. Number two, let's all agree that we will always have more to do than we have time for. So, if we can truly embrace those two concepts, how do we then apply them? Well, if you want, you can go to my online course because I talk all about this leadership mastery from overwhelm to optimal performance.
It's
But
really
there,
good.
yeah, thank you. But there's a key point here, which is, and this is not my idea. This is from David Allen's Getting Things Done methodology. What I've seen dentists do, first of all, we keep sticky notes in business apparently because they're everywhere, all over the doctor's personal office. But what we tend to do is we tend to create these sticky notes or to-do lists that aren't filled with actionable steps. They're filled with, as David Allen would call them, projects. A
Mm.
project in his vernacular, by definition, is anything that takes more than one step. So what happens is this exhaustion kicks in, this overwhelm kicks in because you look at your quote unquote to-do list and it says, for example, hire new hygienist, order chairs, or order new chair,
New website.
new website, right? When in reality, what needs to be on there, if you were at the beginning of each of those processes, write job description, research chair options in my price range,
Hmm.
research web designers in my area if you want to stay
Yeah.
local. So those are next actionable steps. And so there's so much research on how the mind feels, shall we say, accomplished and gives us quote motivation when we actually accomplish something. So what happens is if you have this to-do list filled with quote projects, well, no wonder you feel overwhelmed. And you go, you know what? I'm just going to lay on the couch or I'm going to have a beer or whatever, right?
Because you look at that stuff, like, let's say, even if you're not talking dental, let's say,
Hmm.
clean out the garage,
Yep.
right?
Yep.
A lot of these are multi-hour, or multi-day, or multi-week
Yep.
projects. And
Yep.
so when you're like, hey, I have 40 minutes right now, you're like, well, I can't clean out the garage because
Hmm.
that takes 3 days, right? So
Yeah.
then you never
Yeah.
do it.
Yeah.
But if it started with like clean up trash in the garage first, you can do that in 40 minutes, right? And you can
Yep.
maybe do that in 20 minutes. And then,
100%.
next thing is sweep or something. So you have a
Hmm.
nice area to start organizing. And this made a big difference for me. And where I learned this really well was in the startup world. So
Mm.
in the company that I started, Pearl, um, they, most tech companies and most big companies have some kind of project management website that they use. And it's, they do it so granular.
Hmm. Yeah.
So it's like, I need to do these three things by this day,
Hmm.
and then you check them off. And what's funny is, as you check them off, you get these little like cookies of inspiration. Like, I did
Hmm.
that. Okay, I only have one more. I had three. Now I only have
Yep.
one more. And then you
Yep.
finish that and you go to the higher level. And you go to
Yep.
the higher level, the
Yep.
higher level. And eventually these things get off your plate. And that's why with so much burnout happening in dentistry, a lot of it is overwhelm and feeling out of control.
Hmm.
And when you can break these things down, you start getting this positive feedback. Like, I'm doing
Yeah.
stuff. I'm getting it
And
done.
what you're alluding to is something that we've talked about before and I've said before, which is this. We sit here and we think what we do is unique. But the truth of the matter is, unless the chair's back and the patient's mouth is open, what we do is not unique. And so what you described was a project management office or a
Yeah.
project management officer, often called a PMO. Guess what? Spear Education has a PMO too.
Hmm.
And so any big company or any company of a certain size or greater deploys and employs these concepts so that they get stuff done using
Yeah.
the title again. And so stop thinking that you're different because you're not. And so I say that with love and empathy to help you dig out of this sticky note craziness. Because as we started to say in the beginning of this very episode, some of this stuff we're creating ourselves because we're not looking outside of dentistry for help for stuff that's been clearly established already. And there's, shall we say, less expensive, more ubiquitous versions of project management softwares out there like ClickUp and Asana, and very
Lana,
much,
yeah.
my virtual assistant uses ClickUp as an example.
Mm-hmm.
And so when we meet every week, he brings up the ClickUp and we go through all the stuff. So
Yep.
again, stop trying to reinvent the wheel and utilize these ideas, methodologies, and tools to lower your own temperature, lower your own stress, because there is a different way to do it.
And if you do have team members involved in some of
Mhm.
your projects, it makes it very easy for your team members. Let's say you involve your dental assistant with, I don't know, an ordering or with
Yeah.
redesigning the
Yep.
front office or something, whatever. When they have 20 minutes where, a patient's late, they don't have anything to do, they can simply go on to these project management sites and just say, hey, I've got 20 minutes to do. Okay, one of the things is measure the depth of the chairs. Okay, I can do that. Or, like
Yeah.
so easy to start checking things off. So then your team will be more efficient too.
Absolutely,
And
100%.
this goes back to what Martin and I talk about all the time, which is setting expectations
Yeah.
with people. When people know what's expected of them, it's much easier to keep them on track with what's happening.
Hmm.
It's much
Hmm.
easier to have reviews or growth. What do you call them? Growth something?
Well, it's a spear term. It's growth conferences. Yeah.
Growth conferences. Yeah.
Yeah.
If they don't know what to do,
Yeah.
then it's really hard for them to have 20 minutes and be like,
Yeah. Yeah.
hmm, well, patient's not coming in. I guess I'll just sit here.
Yeah. And let's go back to that term for just a quick second. People are like, "Oh, growth conferences, that's some like PC term." It's like, no, it's not. Because here's the thing. One of my first supervisors outside clinical dentistry once said to me, he said, "Martin, reviews, the typical term for a growth conference, reviews should never be surprises. And if they
Yeah.
are, it's on you as the leader because you are not communicating in the moment or relatively soon after the incident to help that employee understand what it is that they did wrong or how they can improve or what the consequences were. So those meetings that you're having quarterly or twice a year, hopefully at least once a year at least, are growth conferences when we're leading people correctly and correcting behaviors as they go, or at least, shall we say, discussing behaviors as they go.
Hmm. No, you're exactly right.
Yeah.
It's
And it's another way to reduce stress because if you find yourself, because I've seen this uh, also in myself and in my career, because, whether it was at Spear or Vita or, in other organizational pursuits, I've had teams of anywhere between 2 to 22 that have worked for me in the past. So I've had a lot of experience in this and I've misstepped as well. And so, I remember sitting there one time feeling a little squirrely about a quote review, and I remember stopping and thinking, okay, what is it about your leadership that is making you squirrely about this? Because nothing about this growth conference should make you concerned unless there's a real serious problem here, which there wasn't. And so it just turning the mirror on ourselves can be very useful at times.
I mean, we say it all the time, but every problem starts with an awareness that
Hmm.
there may be a skill that you're
Yep.
lacking.
Yep.
So in this instance, it's that you're poor in leadership skills. You're poor in setting expectations.
Yeah.
I'm gonna sneeze. Right now, whoa, baby. Wake up everybody who's listening with their AirPods. Hello, sorry about that. So let's bring this into land. At first we talked about how you're not lazy, you're just exhausted.
Hmm.
And that had more to do with the physical aspect of your life.
Yeah.
So making sure we're taking care of ourselves as if we are these high-level athletes that
Hmm.
are measuring in tenths of a millimeter, working
Yeah.
8 hours a day.
Yeah.
And in the second part, we went more towards you're not lazy because you're not getting things done by showing better ways of thinking about projects and organizational skills
Hmm.
and how that can help reduce stress.
Absolutely. Absolutely.
Any
And
final thoughts?
I was just going to say, and how you do this with your direct reports is really important too. Again, shameless plug for leadership mastery. I talk about delegation. I have a whole framework, but the most important part of the framework is the setup of the delegation. And,
Right.
delegation, that could be a one-time thing or a routine thing, and it has everything to do with establishing the psychological safety that your ability to communicate to your subordinate is as important as their ability to execute the task as the success of the execution itself. So when I meet with my VA every week, he knows I turn around and go, okay, great, read that back to me. And he loves it because we've established that as our working culture. I'm not testing him. I'm not micromanaging him. I am making sure that I have communicated adequately and completely. And I got news for you, folks. How many times do you think per meeting I discover that I didn't say something or thought something and it didn't come out of my lips? Almost, not every time, but almost every time.
Yeah, that's a powerful realization that I think a lot of
Mhm.
people need to
Yep.
have with our leadership skills.
Yep. 100%. 100%.
Well, we hope you guys enjoyed this. If you guys are interested in actually exploring dental I co-founded a company called Pearl. We
Mhm.
analyze radiographs in real time, cross-reference them with your practice management system. It's been a huge trust builder in my practice and thousands of practices around the world. In the show notes, I'll put a link to where you can get my special founders discount. Click there, set up a demo, and see if it's something that you'd like to incorporate into your practice. And on the next episode, we may be telling you about a live event that we're going to be doing in the spring of 2026. So
So
stay
excited.
tuned, and we'll see you next time.
Bye bye.